I'm Michael Barasch. I'm here this evening with my partners, Dom Penson, Dana Cohn, Lee London, and Dr. Joshua Richter, who's a doctor of multiple myeloma at Mount Sinai Hospital. Dr. Richter, thank you so much for joining us. So we're going to start with a short 3-minute video, and then we're going to go and we're going to listen to Dr. Richter talk for about 10 minutes about multiple myeloma. We'll then transition and talk a little bit about the World Trade Center Health Program, then about the Victim Compensation Fund and some changes and deadlines that affect the entire 9/11 community. So with that, let's start with the video.
The first thing that I hear from the non-first responder community in Lower Manhattan is, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
My law firm represents over 15,000 people in the 9/11 community. And the majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11 or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you.
So before we get going, and Doctor, before I hand it over to you, I just want to thank Laura Mooney. Laura runs the Staten Island Multiple Myeloma Foundation. And Laura, I just want to tell you how much we appreciate you organizing this tonight. So now, Dr. Richter, if you'll tell us what you think we need to know tonight about myeloma.
All right. I really just want to take the opportunity to thank all of the first responders for their service and their dedication. And, getting a little choked up listening to what John Stewart and a bunch of everyone had to say. I don't think there's a person, definitely not a person in New York, maybe not a person in the entire country that wasn't touched by what happened that day. And, my corollary to what John Stewart says, get what you're owed. That includes top quality healthcare. It doesn't just mean coverage of bills to make sure you don't have to deal with a financial burden. But please make sure that you are being well taken care of, you and your loved ones. So to switch gears, let's just talk a little bit about what myeloma is from a 10,000-foot view, and really where we're at with the current state of technology and the amazing hope for the future. So, what is myeloma? And in 2020, we define any cancer by what cell becomes malignant. You have a skin cell that becomes malignant, that's melanoma. A lung cell becomes malignant, that's lung cancer. When a plasma cell becomes malignant, that's multiple myeloma. And plasma cells are immune cells that live in the bone marrow and make antibodies to fight infection. And when they become malignant or cancerous, that's multiple myeloma. How common is it? It's considered the second most common heme malignancy or blood cancer. The most common is non-Hodgkin's lymphoma, but in many ways, myeloma is the most common because non-Hodgkin's lymphoma is made up of many different varieties, diseases like diffuse large B cell, follicular. In 2019, there were over 30,000 new patients diagnosed, and there are currently around 130 to 140,000 people living with myeloma in the United States, about 250,000 worldwide. And this number has actually drastically increased, not the new cases, but the total cases from a decade ago. And it's mainly because of the progress we've made in treating it. So if you look at textbooks from a decade ago, they'll say there were around 30,000 new cases, but only about 60,000 people living in the US. And the amazing ability we've had to control many people's disease for years, if not decades, is what's transforming our ability to control this. It represents just under 2% of all cancers. It's about 10% of all blood cancers, and the average age is around 69, with increasing frequency as you get older. What are the most common symptoms? So the most common symptoms, unfortunately, are things a lot of people have and may not realize may be something more complex. Now, that's not to say that if you feel fatigue or feel weak, that means you have myeloma. The most common reason is just like, maybe just like me, either you have a newborn and you've been up all night, or maybe just like me, and again, you can't see further down. I've packed on the COVID-19, as in 19 pounds, and I feel weak and fatigued just from that. But unfortunately, when the bone marrow gets filled up with myeloma, your bone marrow is not able to make the normal healthy cells, so your blood counts drop, you become anemic, you become weaker and fatigued. The bad protein circulates in the blood. Imagine driving your car for 100,000 miles and never changing the oil. That's what happens in myeloma, where the kidneys are unable to filter the bad protein from the blood. It can attack the bones. But one of the most drastic things about the disease is between 10 and 20% of all myeloma patients have no symptoms whatsoever. In that, I literally saw a 51-year-old gentleman in my office today who went to get routine yearly blood work. He felt completely fine, and his routine blood work showed a little bit of anemia and a bad protein, and now he has myeloma. So it's really important to follow up with your regular healthcare physicians, regardless of your exposure, but specifically for 9/11 exposures, make sure you have a good view, a good follow-up with your primary care physician. So again, these are kind of general schematics. You start off with a general stem cell, which gives rise to different immune cells like lymphocytes, and then lymphocytes eventually become plasma cells, and when they become malignant, that's myeloma. And interestingly enough, every cell along this pathway, each one, if it becomes malignant, is a different cancer. If the stem cell becomes cancer, that's leukemia. If a B or a T lymphocyte becomes malignant, that's lymphoma. Only when the plasma cell becomes malignant is that myeloma. So when we take your blood, we want to look for all the proteins. And normally we have this whole complement of different proteins because you have all different antibodies, one to fight the flu, one to fight the shingles, one to fight diarrhea. So what we do in normal cases is we put your blood on a machine and we run an electrical current through it, and it shoots it through, and it says, all right, what kind of proteins do we see? And normally we get this good spread, what we call polyclonal, poly meaning many, that there's all different types of antibodies. This one to fight one disease, and this one to fight another disease, and this one to fight another. That's the normal state. But what happens when you develop myeloma is we put your blood on the machine, run the electrical current through, but this time when we look for the proteins, we find this one group, mono meaning one group of bad proteins, and we know all of these bad proteins come from one group of bad cells in the bone marrow. And that's how we know that you have a disease or a disorder like myeloma. And we find this big spike called an M spike. And we know it comes from cells, and we correlate that. So we know when we give medicine to get rid of the bad cells and they stop making that bad protein, we can measure that in the blood and know that you're responding. Unfortunately, the cells live in the bone marrow. So many of you may be all too familiar with this type of procedure where we have to do a bone marrow biopsy. But we do it to receive a lot of pieces of information. How much is there and what are the genetics? And I'm not talking about the genetics that you got from your mother or your father, you share with your siblings or passed on to your children. It's the DNA of the cancer cells themselves, and we can use that to help custom tailor the treatment to you. These are what the bad cells look like. And although at one level they're quite beautiful, these are the evil cells that we're all trying to attack. They're big, they're blue, and they have these funky looking middles called nuclei. How do we stage it? And this is something that's very different. Almost every cancer is stage 1, 2, 3, and 4. Myeloma, there is no stage 4. We only stage 1, 2, and 3. And we actually don't change treatment. If you're a stage 1, 2, or 3, it has different meanings, but you all get the same therapy. How do we treat myeloma? 10,000-foot view. When we first diagnose a patient who needs treatment, we classify them as being either transplant eligible or transplant ineligible. The transplant is what's called an autologous transplant, where we collect your stem cells. Then we give you a high dose of a drug called melphalan to wipe out your bone marrow and give you back healthy stem cells to rescue your bone marrow. Either way, you receive some type of induction, which is therapy to induce a remission. Some people get transplant, some do not. Some people get put on maintenance therapy, some do not. But ultimately, unfortunately, the majority of people, the disease comes back, and we have a laundry list of drugs we use to treat it. These are the main drugs that are currently FDA approved. There are different classes of drugs. Some of you may be familiar with them. How does it work? We basically draw combinations of 2, 3, and 4 drugs to put together to tailor an ideal therapy for you. This is kind of the 10,000-foot view of how far we've come. The first patient, even though we know myeloma is an ancient disease, some cancers are modern day things. Lung cancer, for example, is more of a modern day advent given environmental and a variety of other factors. Myeloma is an ancient disease. They've actually discovered it in sarcophagi of mummies in Egypt. But the first patient ever diagnosed with myeloma that was identified in her day was a woman by the name of Sarah Newberry, diagnosed in the mid-1840s. She got the latest and greatest of her time. She got therapy with rhubarb and orange peel, subsequently got steel and quinine, and in her final days, they gave her the ultimate in technology, leeches, for bloodletting, because back then that was the latest. And if you can imagine an advanced myeloma patient having bloodletting, it wasn't very good. But in the more recent couple of years, we've had amazing, amazing new drugs. Now over a dozen drugs approved and many ways to find the right therapy for you. Where are we at in the future? There's a website called clinicaltrials.gov run by the government. And I did a search last night for myeloma. And if you can see in the middle there, according to the study, according to this website, there are now 2,764 active trials looking at how to treat and cure myeloma. Where are we at with some of the greatest? There's a couple drugs here that are about to be approved within the next 6 months. So CAR-Ts, which is a way to manipulate your immune system, is going to be approved in the next 6 months. BiTEs, so antibodies that grab a hold of the cancer, grab a hold of your immune system and make your immune system attack the cancer, coming right around the corner. Newer versions of drugs like Revlimid and Pomalyst that many of you may know. Iberdomide is the next generation. Melflufen, venetoclax, and literally the list goes on. And what I told people when I first started this is we can't cure the disease. And now I say, today we cure some, and it is my job to get you to the cure down the road and keep you intact for it. CAR-Ts are kind of this new amazing technology that we have to collect your immune cells, engineer them in the lab, and have your own T cells, your own immune system, fight the cancer and kill the cancer. And this is really where the future of our therapy is coming, and it's set to be approved by the FDA prior to March of next year. We have many clinical trials with it, but the fact is it's not too long until we can give this to essentially everyone. How far have we come? You can see that over the last 10, 20 years, if you look prior to that in the 70s, the average outcomes were not that good. Ever since we started developing newer therapies, we're getting better and better. People are living longer and longer and longer. And I do think that the cure is within our lifetime. And again, anyone who I see now, this gentleman I saw today, 51 years old, I said, we don't have a cure today, but it is my job to keep you around until there's a cure. And I think we're getting there every day. And with that, I always like to end things with, this is not the end. It's not even the beginning of the end. but it is perhaps the end of the beginning. Thank you guys so much for listening to me ramble, and I wish you nothing but the best.
Dr. Richter, I'm so enthused after hearing you. It's so positive, and I don't always hear that when I'm listening to doctors talk about the treatment and the limited treatment for people. All right, so during the video, you might have heard Senator Gillibrand discussing the Houston Street boundary. Many of you know we were in Washington lobbying for the World Trade Center Health Program and the Victim Compensation Fund. What we came up with, what the doctors came up with, was a compromise. I mean, those of you who were living on the Upper West Side, like I was at the time, you could smell that air, even though the EPA assured us it was all safe. But nevertheless, they drew a line at Houston Street and said, if you were living or working, or you were a responder south of Houston Street and even in Western Brooklyn, you are eligible for the benefits of the World Trade Center Health Program. If you were living or working or going to school south of Canal Street, or at the Fresh Kills landfill for the responders, then you're also eligible for the Victim Compensation Fund. It's not fair, but this is how they drew the line. But I just wanted some of you to see in this, the area south of Canal Street, you may recognize a lot of very well-known companies. These are just some of the representative companies for whom we represent over 20,000 people in the 9/11 community. But for instance, we represent 126 clients who were at Goldman Sachs. These are 126 clients with cancer. So I don't have to tell those of you who are listening how scary this is and how deadly a lot of these cancers are. All right, Lee, would you take us through some of the most common cancers? And don't forget number 5 on the list of cancers.
Sure. And thanks so much for everyone joining us today. You know, with the World Trade Center Health Program and the Victim Compensation Fund, you know, many cancers weren't even covered with the World Trade Center Health Program and the VCF back in 2012. And, you know, now we have 68 cancers covered. So the first question I always get is, you know, why should I join these programs when I'm perfectly healthy? What is the point? But we encourage everybody to start this process before they get that moment or before anything's diagnosed, because the benefits of the health program and the VCF are so great. But the biggest cancers we're seeing in the last 5 years, especially number 1 right now, is skin cancer, basal cell, squamous cell, and melanoma. We encourage everybody to get a full body skin check. And I know because of COVID, and the biggest thing that I want to, hammer in today is please go for your checkups. Please do not skip them. We do not want this to happen because of COVID. Many people put off their tests, their normal prostate cancer, breast cancer, and we want to make sure everybody continuously goes. The 9/11 community is more at risk. You're more susceptible, and we just want to make sure that you protect yourselves. But blood cancers, especially multiple myeloma in the 9/11 community, I have seen multiple times. Just like the doctor stated, he had a 51-year-old in his office that was perfectly healthy, no symptoms. So I want to make sure everybody is staying protected. And also in the 9/11 community, there are a lot of non-cancer conditions as well, such as interstitial lung disease, upper respiratory, obstructive airway disease. But early detection is key, and there is a presumption that your conditions were caused by your 9/11 exposure. So when I say presumption, it means you don't have to prove causation. If you were there, as Michael said, in the exposure zone, it doesn't matter if you have a family history. It doesn't matter if your private doctor doesn't know if it's related. You have to get into the health program and trust that these benefits are available to you. You can keep all your private doctors. I get that question asked every day. If you love your private doctor, that is great. But we want you in the health program because you're with others in the 9/11 community, and you might be suffering from something that somebody else in the 9/11 community is, and it hasn't been added as a condition. The only way we're going to get conditions added, new conditions, is if more people join the program and they have the research to support it. So the biggest deadline that we have coming up right now with the Victim Compensation Fund, and that's why we're encouraging everybody, sick or not, register for the Victim Compensation Fund, because many people are part of the World Trade Center Health Program and don't even know it, and don't even know that they've been certified for a condition. That's the key word with this deadline coming up. You have 2 years to register for the VCF. 2 years of date of certification. So many people might be part of the World Trade Center Health Program already. They might have been certified and not know it, but we want to make sure that you register for the VCF before this July 29, 2021 deadline, because we don't want to risk you not, being able to move forward on a claim.
All right, Dr. Richter, I'd actually like to ask you a little bit about this. Are your patients more at risk because of their weakened immune systems to the COVID-19 virus?
So unfortunately, yes. We've actually published a few papers on this. It's quite complicated because it's not just the people who have extremely advanced disease, but even people who are doing quite well in remission, because the medicines we need to keep them in remission will suppress part of their immune system. They may be at a higher risk for severe complications. So, as different parts of the state and country and city vary in their rates, please keep up social distancing. A lot of our office and a lot of offices are doing telemedicine as much as possible, especially for people at higher risk. So I couldn't echo you guys' comment earlier about not neglecting your medical care during these times. The reality is that just as we're having this conversation over Zoom, much of medical care can be administered in this way. Absolutely, definitely an important thing to think of.
All right, thank you. So we've touched on the World Trade Center Health Program. I'm just going to repeat this. Many of you watching tonight are our clients, and therefore we know you are in the health program. But this is really, as Lee said, these are doctors who are trained to treat 9/11 illnesses. They're looking for it. And that's why if your own private doctor says, you had a family history of breast cancer or multiple myeloma, it's probably due to that. Well, no, there's a presumption that your illness was caused by your exposure to the toxic dust, and a regular doctor might not know that. So we urge all of you, take advantage of the free annual exam from these doctors who treat 9/11 illnesses. You can stay with your regular doctors. You can do both. And if and when you are certified with the 9/11 illness, then all your copays, all your deductibles are covered for the rest of your life. So, if you've had cancer, you know how expensive that can be, even if you have the best of health insurance. And if you are a snowbird and you move to Florida, North Carolina, Arizona, California, like so many of our clients, there are LHI facilities, which is a division of the World Trade Center Health Program, all over the country. And then when you come back to New York during the summer, you can be treated here in New York. There's no reason not to register. What's the sad reality is that 80% of the first responders have registered in the health program, but only 5% of those of you who were office workers, downtown residents, students, and teachers, only 5% of you have registered so far. So that's our big mission, is to get the word out there so that people know to take advantage of this. All right, Lee, would you speak to the benefits of the Victim Compensation Fund?
Sure. And just one point I wanted to add, Michael, is that not only do the students and teachers have no idea, but a lot of the retirees have no idea about the benefits of this as well, because a lot of my first responder retirees who left in 2006, 2008 and got cancer wasn't even covered in the Victim Compensation Fund back then. So just getting the word out and being each other's advocates during this time is very important. But to jump to the Victim Compensation Fund and the benefits that they offer, they are amazing in how it has evolved. So they will cover your out-of-pocket medical expenses. So if you weren't even part of the World Trade Center Health Program when you were treating for your cancer or your conditions, and then you join and you had out-of-pocket medicals that wasn't covered by your insurance, we can make a claim directly to the VCF to get that reimbursed to you. We make claims for your non-economic loss for your pain and suffering, which can range based on severity. So as everybody knows, you can have two people with an upper respiratory condition. One person has had 3 surgeries. The other person uses a nasal rinse. The Victim Compensation Fund looks at the severity of your condition. As you can see, skin cancers can range from 90,000 to 250,000, and life-threatening cancers can range from 200,000 to 340,000. Something that I want to point out is that you can make a loss of earnings claim. Many people can get an award for their pain and suffering, be working full time, and then that causes them to be disabled. And that is a economic loss claim for loss of earnings, which we would make to the fund as an amendment to your claim or as the initial claim. But the Victim Compensation Fund has been extended till 2090. The whole point was that many of these cancers, many of these conditions won't even be diagnosed for another 5 years, 10 years. And we could always amend your claim for an increased award as time goes on. So you never waive your future legal right. So if you get an award, today, and then God forbid you get diagnosed with a cancer 5 years from now, which causes you to leave your employment, we can make an amendment to raise your non-economic loss and for economic loss as well. So the benefits from the Victim Compensation Fund are amazing, and there are amazing death benefits also, which Dom and Dana will speak about as well. But this is the program that you want to be a part of. And if you're not happy with your award, we will appeal it. And we've done them many of times, but this is just a small amount of benefits from the Victim Compensation Fund right now, but definitely worth taking advantage of.
All right, thank you, Lee. Okay, Dom, would you please talk to us about the Victim Compensation Fund death benefits?
Sure. There are many people after 2001 who passed away from what is now a linked World Trade Center related illness. But at the time that they passed away, their families had no way of knowing that they would be eligible for benefits. At that time, they were not eligible for benefits. Years passed, and at some point, the families became eligible for benefits. Mostly, in that point was in 2013. What that means going forward is that for all of those people, all of those families who got that opportunity and haven't taken advantage of it, they must do so now before this deadline expires July 29, 2021. So this is partly why it is so important to spread the word, because there are many people, for very good reason, who had no idea that they were entitled to these benefits because they weren't. They became entitled and they don't know about it. So what you can do is to spread the word to the 9/11 community so that for those who have lost somebody in the past, they take advantage of the benefits to which they are entitled by the deadline next July. With respect to the death benefits, they include all of the benefits that Lee talked about. If a family such as the families that I've been talking about just now, if they didn't take advantage, if their loved one in life did not file a claim with the VCF, did not get any kind of VCF award, the family can still get that award, the personal injury award that the decedent would have been entitled to during his or her lifetime. In addition to that, the family is entitled to deceased benefits that include more award for pain and suffering, for the decedent's pain and suffering. They include direct awards for dependents and spouses. They include lost earnings for the earnings that the decedent could have earned had he or she continued to live. They include something called replacement services for the things that the decedent used to perform around the house, contributed to the household. That has a value. The VCF places a value on that, and it awards money for the loss of those services. And it also reimburses funeral expenses, whatever they may be. These awards can be very substantial. They can add up to hundreds of thousands of dollars and millions of dollars, which is why it's so important that if you are healthy, you do what you can today to help your family should you ever pass away from one of these illnesses. And Dana, what can we do to help our families today?
Thank you, Dom. Doing this work, we've learned some very important lessons about what all of us can do now to protect our families. They're simple things, but they're very important things. 1 in 2 families who come to us more than 2 years after they've lost a loved one. In other words, if not for this extension, they would have been too late. So the most important thing that you can do for your family is talk to them. And what should you tell them? Tell them that you were there. Tell them that if you were ever to pass away from one of these 68 cancers or one of the respiratory illnesses, that they will have a claim. And make sure they understand that there's a presumption. Don't let them think that some doctor has to make the connection. There is a presumption and they have to know that. Make sure they know that there's help available. The death benefit claims can be a little bit more involved. They are more involved than the personal injury claims. There's help for them, so they don't have to take it on by themselves. And make sure they understand that there are registration deadlines, there are filing requirements. Nobody's going to come to them. They have to seek this out. And you can give them permission, because someone going through a loss sometimes needs that. And very often from our clients, what we hear is, he would have wanted me to do it. He wanted me to do it, and that's why I have the strength to go through with it. So talk to them. It's 19 years since the September 11th attacks. And the proof that the Victim Compensation Fund requires is 2 eyewitnesses who saw you there. As the years march on, that becomes harder and harder to find. For some people, it's very hard. So if you do that now, you won't be leaving it to your family to do it 10 years, 20 years, 30 years, 40 years down the line. Get in the program. Even if you have a minor illness, get in the program. If you have sinusitis, if you have something, that maybe you can ignore and live with, still get in the program. Why? Because you'll get your proof of presence. The VCF will confirm that you were there. They will find you eligible, and then your family will never have to do that. It will be done. So get in the program. And if you aren't in the program, get your proof of presence in order. Find your witnesses, and we can send you affidavit forms to provide to the witnesses, so you can get those statements that you need. We can review them for you to make sure they're adequate. That's so important. And the last thing that I'm going to tell you is that all of us in the 9/11 community should have a will. It's so important that we do it for all of our clients for free. And here's why. A part of the Victim Compensation Fund award is actually going to be distributed according to your will. You will have a say as to where part of the award will go, and you know where it's most needed. If you don't have a will, that part of the award is going to be distributed according to intestacy laws, which are not what most people want. It's a formula that the government has come up with. Additionally, you can appoint your executor. The executor is the person who's going to be able to bring this claim. That's the person you'll have spoken to, and that's the person that you have faith can see it through. And lastly, it's generally a faster process where there's a will. Where there's a will, our clients typically end up shortening the wait time for their money. So those are the most important lessons. Again, talk to your family, get your proof of presence in order, get in the program, and get a will.
You've heard this all, but it's good to go through it one more time. Register with the health program, so important. Once you get your eligibility or your certification letter, you want to register with the VCF, with the Victim Compensation Fund. If you haven't yet registered, you want to secure your proof of presence. You want to secure it now, even if you're healthy. Get that proof of presence now, show it to a lawyer. And we can't overemphasize this. The health program doesn't provide annual skin checks. It's the chink in the armor of an otherwise very, very good program. And because we who are in the 9/11 community are at increased risk for skin cancer, get an annual skin check. It's very important, please. And lastly, like Dana said, get a will, get a healthcare proxy.
And I'm going to add, spread the word. There are so many retirees who are living outside the New York area who have no idea they are entitled to this. They don't know about next July 29th deadline. There are so many widows and widowers and family members who have lost loved ones. If your husband died in 2008 due to prostate cancer, or your wife died in 2011 to breast cancer, this is before cancer was even added. And then you move to Florida. Why in the world would you know that you're entitled to $350,000 or more. You wouldn't. So we're relying on, as someone said earlier, I think Lee said, we are each other's advocates. Please look out for your neighbors, your former coworkers, your former students who worked with you, who went to school with you, and make sure they know, as John Stewart says, take advantage of your rights. I have to tell you, it's such a wonderful feeling for us to know that we can help someone before they pass, and they at least know that their spouse, their children are going to have financial security. That is such a wonderful feeling for someone who is facing hospice and facing the end of his days. I want to thank you all again for coming tonight. It is our pleasure to be here as a resource for you. Please don't hesitate to reach out to us anytime.